If you have insurance already through your employer, you get to keep it. And that's good news because it gives us sort of a stable base to build on. This bill first addresses people who don't have insurance, in particular those who have been closed out because they have a pre-existing condition. Beginning this year, children with a pre-existing condition will have insurance.
Has anything changed for Ms. Canfield?
I'm not sure about that, but by 2014, adults with pre-existing conditions will be insured. They can't be charged more because they've been sick. That's a huge step forward for a great many people, and that's terribly important. In addition, a great many people will be added to the Medicaid rolls. Poor people in some states weren't able to get on Medicaid, no matter how poor they were, because they didn't have children. And the worthy poor were people who had kids. Well, now everyone is worthy
now we know
to be on Medicaid. Yes.
To be worthy, but everyone can be on Medicaid.
Yes.
Jacob, back to you, or to you on this. Does anything change for you today?
Well, absolutely not in terms of my health coverage. And as Maggie said, if you have employment-based coverage, and Yale University, my employer, offers good coverage, your coverage won't change. But there are a lot of changes that go into effect very quickly, not the big ones, but in addition to not having pre-existing coverage exclusions for kids, it will also be possible for older kids, those who are younger than 26 but older than 21, to be able to stay on their parents' insurance policies. There's going to be some new transparency regulations in the market right away. I mean, I think the really big changes are all going to take place in about 2013, 2014 under the law, including the creation of these new health insurance exchanges where people who can't get coverage through their employer, who don't get coverage through their employer, can get insurance, where small employers will be able to buy coverage. And one big change that will happen right away is that there'll be tax credits offered for small employers, those with 50 or fewer workers, to have coverage. So there are a lot of positive things in this legislation. Most of them won't take effect immediately, but those that will take effect immediately are going to be very helpful to those who are most disadvantaged by the system today.